This conference will now be recorded.
Okay. Today's topic is HIRSUTISM. Coming to the definition of HIRSUTISM, HIRSUTISM is defined as a distribution of coarse hair in a female normally present in a male. That is, Hirsutism is a distribution of the core hair in male sexual parts. What are our male sexual parts? That is upper lip, chin, chest, lower abdomen, thighs, and all. Hirsutism may or may not be associated with menstrual disturbances such as oligomenorrhea and amenorrhea. When we need to know about the hirsutism, we need to know exact definition of hirsutism. What is actual meaning of hirsutism? It is excess of lanugo hair. That is excess of normal patterned hair. Then we need to know about three definitions. What are those? Hirsutism, virilization, and hypertrichosis. Hirsutism, when coming to the definition of hirsutism, it is defined as distribution or excessive growth of coarse terminal hair in male sexual parts. That is hirsutism. Coming to the definition of hypertrichosis, it is excessive growth of or thick growth of coarse terminal hair in sexual, non-sexual regions. That is hands, thighs, legs, and all. That is hypertrichosis. Coming to the definition of virilization, virilization refers to a condition of hirsutism which is associated with other male characteristic features such as temporal baldness, hoarse voice, clitoromegaly, and muscle enlargements, as well as defeminization such as amenorrhea and breast atrophy. In virilization, hirsutism is a part. When hirsutism is associated with other male characteristics such as temporal baldness, hoarse voice, clitoromegaly, muscle enlargement, and defeminization, such as when the female presents to you with amenorrhea, breast atrophy, and all, then she comes under virilization syndrome. Whereas hirsutism is only one entity of virilization, where there will be excessive growth of terminal hair in male sexual parts. These are the sites where hirsutism usually we notice. That is lower chin, hands, inner parts of thighs, abdomen, and all. Coming to the pathophysiology of hirsutism, it involves a combination of the following. Usually, here main pathophysiology in hirsutism is there will be increased concentration of serum androgens, especially the testosterone. Where from we get testosterone is normally androstenedione is a compound which is produced both by adrenals and ovary. This will be converted to normally testosterone by 5-alpha reductase and all this pathway. But here, there in these females or in these young women, there will be increased production of androgens, which results in increased conversion into testosterone, which is the main culprit in having coarse granular hair. That is presence of hair in the male sexual parts. Decreased level of serum HBG, resulting in increased free testosterone, increased responsiveness to the target organs to normal circulating androgens. This may be related to ethnic ground. That is, Oriental women have less number of follicles per unit area when in skin compared to the Caucasian women. Increased activity of 5-alpha reductase, which converts the testosterone to dihydrotestosterone in the skin and the hair follicle, which further stimulates the growth of coarse terminal hair. So what are these pathophysiology? Increased testosterone concentration, that is increased concentration of serum androgens, decreased level of serum SHBG, resulting in increased free testosterone or increased responsiveness to the target organ in normal circulating androgens. These are the causes, pathophysiological causes, which further produces the coarse terminal hair. Hirsutism may be associated with excess androgen production either from the ovaries or adrenals, as I have told you before, or excess stimulation of endogens, that is the hair follicle. Which stimulates the hair follicle? 5-dehydroxytestosterone. How it is produced? It is a end product of testosterone cycle which gets converted into dehydrotestosterone by 5-alpha reductase, which stimulates the hair follicles and thus formation of coarse hair. It represents one of the early manifestations in the spectrum of virilism. Virilism is almost always associated with hirsutism, but hirsutism may not be associated with virilism. This line indicates that in virilism syndromes, hirsutism is one entity. But in hirsutism, virilism is not an entity. Virilism is a syndromic approach where hirsutism is commonly encountered. But when you are dealing with hirsutism, you need to keep in mind whether she fits in virilism syndromes or all or not. So you have to rule out other causes of hirsutism also. Their hirsutism may be racial or familial link. Increased hair growth is observed during puberty, pregnancy, and following menopause. Genetic causes: genetic, ethnic. Excessive androgen or increased sensitivity of pilosebaceous unit to the testosterone. Liver diseases, which causes a decreased level of SHBG, which results in increased levels of free testosterone, thus gets converted into 5-DHT by 5-alpha reductase, and which causes the stimulation of the hair follicle. Or ovarian causes such as PCOS, hypothecosis, masculinization, ovarian tumors and all. Adrenals, congenital adrenal hyperplasia, Cushing syndrome, adrenal tumor, because from the adrenal 50% of androstenedione is produced, that the androgens main is produced. Drugs also might cause hirsutism, such as androgens, progestogens with androgenic effect, 19 non-steroids or levonorgestrel, phenytoin, denosolol, minoxidil. Others such as obesity, hypothyroidism, anovulatory hypoestrogenic, and idiopathic causes. Hirsutism occurs early in congenital adrenal hyperplasia. Around in congenital adrenal hyperplasia, hirsutism will be seen early. In PCOS during the puberty, and in LAD women during the menopause. This is a modified Galway score through which Ferriman-Galway score, that is FG score, which you might get a question on this for 4 marks, I mean short answer or 2 marks question, something like that, where according to this distribution, we characterize the woman in which score she fits and how much her hirsutism score is. So where are the parts where we see in hirsutism is 9 parts. They are upper lip, chin, chest, abdomen, anterior wall of abdomen, midline, back, inner parts of thigh, and around the buttocks. These are all the places where we see, and according to them, we characterize into 0, 4, and quantitated hair growth will be seen depending upon the score. See, if suppose she has if suppose a woman comes to you saying that she has a hair growth on the lips, then you need to see 1, 2, 3, 4 on the lips and compare with the woman's hair growth, tick that. And finally, suppose she fits into 1, then again in chin she fits into 2, again in anterior chest and all she fits into 1. Like that, you have to tick this box and finally score it, like 1 plus 1, 2, 3, and you have to sum up all the numbers and see if the whole total score is more than 8, then definitely she has hirsutism features. This is a Ferriman-Galway score. Coming to the causes in PCOD, 80% of women with hirsutism, its main cause will be PCOD, which is characterized by oligomenorrhea, obesity, hirsutism, and often infertility. Here, both the ovaries are enlarged and covered with thick, smooth, fibrotic, pearly white capsule. Multiple small 2 to 8 cysts are seen, which are peripherally arranged in a necklace pattern. These will be seen under ultrasound, where you will see the size of the ovary is enlarged, where multiple cysts are present, and thickened stroma will be there, which is the diagnostic feature of PCOD. Um, and confirmation of diagnosis. When you send an hormones, LH level will be raised in the pre-ovulatory phase of the menstrual cycle, causing high LH-FSH ratio. This results in anovulation, high estrogen level, but absence of progesterone. About 50% of women with PCOD will show raised levels of androgen, and T level, although raised below 200, unlikely that it is an ovarian tumor. Causing other causes masculinizing ovarian tumors, causes defeminization such as breast atrophy, amenorrhea, besides hirsutism, hoarseness of voice, and muscular development. Clinical examination may not always detect a small tumor. Laparoscope, ultrasound, and MRI may be required to locate the tumor. Removal of the tumor restores the menstrual cycle, but hoarseness of voice and existing hirsutism may require enlarged management. Congenital adrenal hyperplasia is the next cause for hirsutism, where it is usually diagnosed and treated before puberty. It is due to the deficiency of enzyme 21 hydroxylase. 17 hydroxyprogesterone plasma level is raised more than 8 nanograms per ml. This is the DA diagnostic test, blood diagnostic investigation to rule out CAH. The other thing is CT scan or dexamethasone suppression test can also be done. How to approach a hirsutism patient? Clinical approach to pinpoint diagnosis. You need to ask her from when history, onset, and progression. Physical examination to rule out the so that you can come to a score according to FG score, that is Fairman Galway. Assess the severity of hirsutism and virilism, underlying causes, investigations, and treatment. Onset of progression usually begins in early adolescence. Presentation may be late depending upon the cause. Rapid progression, usually the cause might be androgen secreting tumors. In endocrinology, in a woman, androgens are secreted by ovaries and adrenal glands in various proportions. To some extent, they are produced by the peripheral conversion of androstenedione in the fat also. The androgens usually produced are 25% comes from adrenal gland, 25% from ovaries, the rest from the peripheral conversion. The testosterone constitute These are the amount of testosterone, dehydroepiandrosterone, and androstenedione, and DHAS sulfate, which is usually there. Investigations, history, as we know, other than the hair growth, we need to ask for any change of voice, breast shrinkage, amenorrhea, which indicates any virilization syndromes. History of any drug should be asked. Usually minoxidil and all have to be asked before. Infertility may indicate a possibility of PCOD as underlying cause for hirsutism. Examination should be done. Degree of hirsutism, change in the voice are noted. Breast palpation is done. Search for any abdominal tumors, cleidromegaly, enlargements, and pelvic masses, which we should be done by a bimanual examination. Hormonal studies such as testosterone, DHEA, and thyroid profile. LH level should be investigated, because if there is LH to FSH ratio more than 1, then underlying cause of hirsutism might be PCODs. You need to go for ultrasound to rule out any adrenal tumors or ovarian tumors or ovarian size, number of follicles to rule out PCOD. CT scan and MRI are suspected if you are suspecting any pituitary or adrenal gland tumors. Laparoscopic visualization of pelvic organs should be done. Dexamethasone and ACTH tests are necessary when you are suspecting 17 hydroxyprogesterone deficiencies. The main management of hirsutism is principles of treatment. You need to remove the excess hair to suppress or neutralize the action of androgens to remove the source of excessive androgens, which stimulates the hair. Principles are the best results are achieved by combination of treating, including anti-androgen suppression. Goal should be reduced. Goal should be to reduce the time spent mechanically removing the unwanted hair. The choice of drug depends mainly upon its tolerability by each individual patient. How to suppress the excess androgen action? Drugs usually which suppresses the excess androgen action are depending upon the site of production. Usually we give first line of treatment is OCPs, progestogens, anti-androgens, spironolactone, dexamethasone, GnRH and analogs. Usually combined approach is done. Combined approaches with the cosmetic treatment where you go for bleaching, shaving, plucking, waxing, or depilator creams, electrolysis, and laser, which is of cosmetic approach, along with drugs. The removal of source is a main mode of treatment in hirsutism. If it is a adrenal or ovarian tumor which is causing hirsutism, then there is no role if you keep the patient on OC pills for a prolonged time. So the main source should be treated surgically, where adrenal or ovarian tumor is removed. If you are suspecting Cushing's disease, adrenalectomy, radiation to the pituitary, removal of ACTH producing tumors, iatrogenic causes offending drug to be stopped. This is a brief topic of hirsutism. When someone asks you about hirsutism, you need to know first the definition of hirsutism, the differentiation of the main difference between hirsutism, virilization, and hypertrichosis. Hirsutism is excessive growth of coarse terminal hair in male sexual parts, whereas hypertrichosis is excessive growth of hair in a non-sexual parts. What do you mean by male sexual parts? What do you mean by non-sexual parts? Uh, like male sexual parts are all is your FG score box: upper lip, chin, anterior abdominal wall, uh, chest, anterior abdominal wall, back, inner parts of thigh, buttocks, and all. This is male sexual parts, means where usually males have excessive hair and which is normal. If you see a woman having excessive hair in these areas, then you need to understand that is she is an hirsutism female. If there is hair in a normal non-sexual parts such as excessive eyebrows, hands, legs, in the eyelashes and all, then it is hypertrichosis. Coming into the definition of virilism, it is a syndrome where hirsutism is one entity with other entities such as deepening of voice or hoarseness of voice, amenorrhea, breast atrophy, and other male characteristics such as temporal baldness and clitoromegaly and all. Virilism is a syndrome where hirsutism is one entity. And you need to know about the definitions of hirsutism, hypertrichosis. Then comes your Ferriman-Galway score, where if the score is more than 8, then you the diagnostic, she is defined as hirsutism female. This box and the score you need to know much. Then you need to know main cause of hirsutism, that is a pathophysiology of hirsutism. That is, it involves a combination of either increased concentration of serum androgens, which is especially testosterone, or decreased levels of SHBG resulting in increased free testosterone, or increased responsiveness to the normal circulating androgens, or increased activity of 5 alpha reductase, which converts the testosterone to dihydrotestosterone, which further stimulates the hair follicles, thus converting the lanugo hair into thick coarse hair. This is the pathophysiology of hirsutism, definition, Ferman-Galway score, and the treatment. Treatments are either you need to go for a cosmetic, drugs, or remove the cause. If the causes such as it is adrenal tumors or ovarian tumors or pituitary tumors have to be removed. If the underlying cause is PCOD, for which the female is having excessive hair, then PCOS has to be treated. If it is due to the drugs which she has been using since long time, such as minoxidil and other drugs, then the drugs has to be discontinued and checked for. That's it. If it is the other, I mean, if she comes under virilization syndrome, then you need to cover about that thing. This is a brief discussion of a small topic, hirsutism, which you might get as a whole topic for 4-mark question. Or you can get even a Ferman-Galway score for 2 marks or pathophysiology of hirsutism for 2 marks. That's it. Any doubt? This is a small topic, though we have kept it as a separate topic because this topic is usually asked in the exams, Viva and all. So we thought we'll discuss separately the small topic. So we have put this topic for today. Any doubts? Hello? Hello?
No, ma'am.
అసలు విన్నారా అమ్మా? హలో? హలో?
Yes, ma'am.
అసలు మీకు ఈ క్లాసెస్ ఏమైనా అర్థమవుతున్నాయా? Are these classes useful for you?
Yes, ma'am.
Hello? Hello? Hello?
Yes, ma'am.
మీకేమన్నా యూస్ఫుల్ ఉన్నాయా ఈ క్లాసులు? అసలు కొంచెమైనా అర్థమవుతున్నాయా అమ్మా?
Yes, ma'am.
ఇంకేమన్నా స్పెషల్ టాపిక్స్ కవర్ అవ్వలేదా? మీకు ఇంకో 2 months లో ఎగ్జామ్సా? హలో?
Ma'am, yes, ma'am.
హలో?
Yes, ma'am.
నేను అడిగిన క్వశ్చన్స్ కి ఎస్ మ్యామ్ కాదు, నేనేం అడిగాను, మీ ఎగ్జామ్స్ ఎప్పుడు, మీకు అసలు ఈ క్లాసెస్ అర్థమవుతున్నాయా అని అడిగాను. మీ క్లాస్ రిప్రజెంటేటివ్ ఎవరు?
Ma'am.
మీరు ఈఎన్టీ ఆఫ్థాల్ బ్యాచా?
Yes, ma'am.
మీకు అసలు ఈ క్లాసెస్ ఏమన్నా యూజ్ ఉందా అసలు ఈ క్లాసెస్ వింటున్నారా? ఓన్లీ జస్ట్ లాగిన్ అయి పక్కన పెడుతున్నారా?
వింటున్నాం మేము అందరూ.
సరే అమ్మా. మీకు ఏమైనా టాపిక్స్ కవర్ అవని ఉన్నాయా?
మేము కనుక్కొని చెప్తాం మేము అన్ని ఏమైనా ఉంటే.
సరే అమ్మా. థ్యాంక్ యూ. దట్స్ ఇట్.
థ్యాంక్ యూ.